to consider at least getting a quote from the program, especially if you do have a current plan in place today. Really, at the end of the day, the main advantage of being part of the program, which we've listed here under the unique features of the ECB Group Benefits Program, the main one is really the buying power of being part of a large group, and that's the end result of that is substantially low administrative fees to run the plan. When you look at group benefits, and just take an example today of there's a few centers that have come to us for quotes that currently have a plan in place today. And one of the big differences, besides being able to provide them with significant cost savings, is the administrative costs that are built into their plan, their existing programs to run their plan. And under an association plan, we're driving down that cost substantially. And what the end result of that is lower costing for you and your employees. In addition to that, we can add to the program other value-added services over and above just doing things like paying for prescription drugs and dental expenses, adding programs like employee assistance programs, which provides support for you and your employees and their families in the time of need, in situations where maybe they're going through marriage issues, or they're going through work-related issues, or health issues, or maybe they have a teenage son or daughter abusing drugs or alcohol. They would have access to meet with and speak with counselors to help them deal through these kinds of situations. In addition to that, it provides things like full travel insurance. When it comes to travel insurance through a group benefits program truly is the best coverage you can buy in the marketplace. Essentially covers you for any expenses that you incur while traveling outside of your home province, whether it's throughout Canada or worldwide. So there'd be absolutely no need for you to go out and purchase additional coverage elsewhere through any other type of programs. Done is we've tried to create a program, sort of not one plan fits all, but to give centers the opportunity to choose from a number of different plans based on a couple of things. One, in terms of interest, but secondly, obviously, in terms of budgets. It's always better to start with something and then maybe improve on that coverage versus starting from a Cadillac plan and finding out that maybe it's not affordable over the long term. So for those centers, that currently do not have a plan in place, essentially, if they were to contact me after collecting a bunch of initial information in terms of employee information that would be eligible under the plan, we would come to you with 3 different options in terms of the type of coverage that you would be looking at. And at the end of the day, where the differences would be in things like the extended health care. So option 1 would provide 80% reimbursement for prescription drugs, whereas option 3 would be 70%. And then option 2 is sort of the middle of the road. Some of the other types of coverage that would be eligible under the plan would be reimbursement for expenses incurred through various paramedical practitioners like a chiropractor, massage therapist, naturopath, psychologist, speech therapist, and so on and so forth. They're all listed there for you. Option 1 would provide up to $400 per practitioner, whereas the other options do provide the $400 per practitioner, but also have a combined maximum of $1,000 across all practitioners wrapped up into one. And there would be various levels of vision care, again, depending on what option you choose. So option 1 being, if you want to refer to it as the Cadillac plan, would provide reimbursement up to $200 every 24 months for vision care. Option 2 would be $100, and then option 3 being sort of the base starter program, there'd be no vision care coverage there. I had mentioned the out-of-country coverage. And then the final piece of the group benefits program would be the dental insurance. And again, based on the option that you choose, you can see option 1 is the richest coverage. It provides 100% reimbursement for all your basic services, so that would be things like your cleanings, x-ray scalings, root canal gum therapy, fluoride treatments, all those basic services. And then it would also provide a second layer of protection for the category classified as major restorative, which is essentially caps, crowns, and dentures at 50%. And then a third level being reimbursement for orthodontics or braces for dependents under the age of 18. And again, it would cover 50% of any costs incurred from that perspective. We're at the other realm of the spectrum. You've got option 3, which is essentially 80% reimbursement for all basic services, no coverage for major restorative and orthodontics. So if you are looking at coverage for all employees of the center, the idea would be that the executive director of that center or the employees as a group decide what option they want in place rather than each employee picking their own option. And the reason that we recommend this route is it just makes the plan more manageable from the perspective of the executive director. For those centers or individuals that already have coverage in place, you're not stuck with the plan designs that we're showing here. We can match any particular coverage that you have in place today if that's important to you. What we have been finding is that the centers that have come to us for quotations that already have a plan in place, those plans have fit in nicely to one of the 3 options that we already have available, and again, at a significant cost savings. The other advantage of the plan is that for certain benefits, we've negotiated long-term rate guarantees of up to 3 years, so the pricing of the plan is pretty stable over the next number of years. I think in terms of a quote process, what I would recommend is the first point of contact would be myself. So at the very last page of this document would provide my contact information, so pricing. So this would be if you wanted to get a ballpark of what it would cost per person, whether depending on the income that you're earning and whether you require single or family coverage, and depending on what option you choose. Again, this is meant to be a ballpark. If you are interested in getting a quote on a specific group of individuals, then the first point, your first step would be contacting me. I would provide you with a form that I would need you to complete, and then based on that information, I would come back to you with a detailed proposal and exact, accurate pricing on what it would cost to provide coverage for yourself and or the employees in your center. So the way to read this chart would be if you're earning $30,000 today and you required family coverage and you wanted option 2, you're looking at a monthly cost of about $219.36 a month. Okay, so pretty easy to follow this chart along. But again, if you're looking for some specific pricing, then first point would be to contact me directly. And as I was alluding to on the very last page of this brochure, you will find my contact information. But again, that's really at this point all I wanted to point out regarding the benefits. As I mentioned, we've had great uptake already. We're only a couple of weeks into offering the plan. We're looking forward to growing the plan. At the end of the day, the more participation we can have in the program, the better pricing we can negotiate, and the better stability in the plan over the long term. Just to give you a sense of the other 2 provinces, in particular the Manitoba Child Care Association, as I mentioned to you earlier, we've been running that plan since 2008. That plan has now grown to about 110 centers and over 1,100 members that participate in the group benefits program. So you can appreciate that plan's grown pretty big. So we've been able to provide some pretty consistent, stable pricing to those plan members over the years, and our goal would be to grow this plan as large as possible. So with that, I guess I'm open for questions from anybody.
So you were just talking about providing the insurance benefits to large organisations. So the organisation I work for is quite large. So is it something that possibly it would be worth them looking into if it was going to be a cost saving for the organisation?
Yeah, definitely. Yes, definitely there would be a great opportunity to generate some cost savings. So yes, what I would suggest to you is if you email me your contact information, then I'll get in touch with you directly, and then we can talk about next steps from there.
Okay, I'll forward an email to the executive of the organisation, and I guess they'll take it from there. I'm a very new member to the organisation, but if there's any cost savings, that would be beneficial to everybody.
Oh, definitely. Sure.
Sure.
Thanks,
you. Dave. Thank you.
Wonderful. Thanks, Rob. Are there any other questions for Rob?
Yeah, this is Emily here. Rob, can you talk a little bit about, like, you know, we talk often about big center and programs, but can you talk about what this might mean for somebody that maybe there's only 1 or 2 employees, and are they able to access that, or how they access the fund? Or the
so great point, Emily. So this plan is available whether you're an individual that runs a daycare out of your home. You can sign up as 1 individual, or whether you have a center of 5 employees or 3 employees or 100. And that's the beauty of this kind of program, is that you're benefiting from the buying group of being part of a larger group. So the pricing you're going to get is based on a large group of individuals versus you going out on your own and getting a quote through an insurance company directly based on 1 individual or 3 individuals. And again, that's why I keep bringing up a few of the centers that have provided us with what they're paying today for their benefits program through a Great West Life or through a Manulife directly. You know, we're reducing their benefit cost by as high as 18% in some cases. So, you know, we're not talking about, you know, nickels and quarters here. We're talking about hundreds of dollars that these centers are saving, you know, as of May 1st by rolling into this plan. And again, that's the true advantage of being part of an association plan, is benefiting from that buying power. And then secondly is the long-term cost stability in the program, because the last thing you want to have happen is you start a program and then in 12 months or 24 months the cost of that plan skyrockets and it becomes unaffordable, and now you need to reduce benefits or take them away from your staff.
Again, just one more. I know we have a member that's on the phone, and I don't know if you heard her when she was mentioning that for the majority of her work, she's a private contractor, so she works with children that require support because they have autism. Mm-hmm. And so would that person, because they're a member of ECEBC, be able to access the benefits as well as a contractor or self-employed?
Yes, they would, definitely. So again, I would recommend send me off an email, and then we can work on getting you some pricing.
Thank you.
Great.